Hello, class. Today we're going to look at seizures and breathing emergencies. It'll be about a 15-minute video. Seizures will be first. And when we think about a seizure, a lot of times, you're thinking about a person reacting. It might hit their head. They might be flailing on the floor, those type of scenarios. So let's look and see what we would do. Here we go.
Seizures, stroke, diabetic emergencies, breathing emergencies, and poisoning are all common types of sudden illnesses. To the untrained eye, these emergencies may be tough to spot. For example, sometimes a person suffering a diabetic emergency might just look tired or confused. Rather than just writing off odd behaviors, it's your job as a first aid responder to recognize signs and symptoms of a sudden illness in order to respond and give appropriate care. While there are specific signs and symptoms for each type of sudden illness, there are some more general things to look for. Changes in levels of responsiveness. This could mean the person is confused, unaware of surroundings, or simply not alert. Call 911 if the person becomes unresponsive, has trouble breathing, chest pain or persistent abdominal pain, severe burns or swollen or deformed areas, vomits or passes blood, is suspected of ingesting a poison, or suffers a stroke or seizure, or if the person is suspected of an injury to the head, neck, or spine. The general rule is, when in doubt, call 911. Until help arrives, your primary goals are to care for any life-threatening conditions, help the person rest comfortably, and watch for any changes in breathing or responsiveness. Always remember, no matter what sudden illness emergency you're responding to, use the check, call, care process to respond quickly and effectively.
Okay, that's something we had talked about before, and if you recall, sample, you'll see how that's utilized throughout a lot of these missions, and eventually when we get to CPR and working with the defibrillator, you'll see when we look at the ABCD part of the evaluation on a victim. So let's go to, after you looked at that brief summary, we're going to go next to a mission, and we're going to start a mission. And as we do this, excuse me, I'll add some comments.
Deborah is having a seizure in the break room. You need to take action to make sure she is safe during and after the seizure. Your first priority should be checking the scene and removing any hazards you see.
So we're going to look over here.
Notice anything here?
That chair is in the way.
Excellent. Chair has been moved out of the way. When a person is suffering from a seizure, the best way to check the scene is to make sure there are no objects around that could injure the person during the seizure.
Okay, let's check.
If you're able to, remove any nearby furniture or other objects that may injure the person. Everything looks okay over here.
Looks fine.
No apparent hazards. Good. You've checked the scene and identified all potential hazards. The scene is safe. While checking, you didn't notice any severe life-threatening bleeding.
Don't see any. Okay, now, when you think about obtaining consent is the first thing, but obviously this person's not, but we'll just check on that and see what happens.
In this situation, the person is unable to respond, and the situation is life-threatening. This means consent is implied.
So that's implied consent. So we're going to call 911.
If this is the person's first time having a seizure, or if you're unsure whether it is, 911 should be contacted. But since there's a bystander present, you should have him call 911 while you continue to help Deborah.
Okay, let's talk to him.
If this is the person's first time having a seizure, or if you're unsure whether it is, 911 should be contacted.
Okay, we're going to ask if Wiley here, what he knows.
I've known her for years, and she's never said anything about seizures.
We're going to have Wiley call 911 and go get a first aid kit if possible.
Okay, but is she going to be all right? I think you need to put a stick in her mouth so she doesn't bite her tongue. Oh my gosh, should we hold her down or something?
Wiley here is giving you bad advice. You should never attempt to put anything in a person's mouth when he or she is suffering a seizure. Also, never try to restrain a person having a seizure. This could lead to further injury.
Okay, I'll go call 911.
Deborah's seizure appears to subside.
So we're going to check her responsiveness and breathing at this time.
What is the correct way to check for responsiveness?
Okay, so you have three choices here. The first thing, because it might be a body injury, but let's just see if she's conscious, if we can shout, "Are you okay?"
To check for responsiveness, first shout, "Are you okay?" Then tap the person's shoulder and shout again, checking for breathing. Deborah seems to have responded. Complete your check and observe her breathing.
Okay, so it said about tap the shoulder, shout again, look for normal breathing.
Oh. Deborah seems responsive, and her breathing is normalizing. Now, place Deborah in a recovery position.
Okay, we're going to show you what a recovery position is.
Her body is in what is called the recovery position. This position protects her airway. After a seizure is over, it's important to make sure the person is breathing. In this case, Deborah seems to be breathing fine, although she's a little shaken up. After a person has a seizure, it's very possible he or she will be unresponsive or not alert at first. It's also possible for a person to feel drowsy, confused, or embarrassed if the seizure happened in a public place. That's why it's important to comfort and reassure the person, check for injuries, and stay on the scene until help arrives or until the person is fully conscious and aware of his or her surroundings. As you continue to monitor Deborah, EMS arrived to take over.
Okay, so we're finished with that mission. We're going to return home. And the next one, excuse me, we're going to look will be breathing emergencies. Here we go.
Many people suffer from allergic reactions to certain foods, pollens, venoms, and antibiotics, among other things. A mild allergic reaction could be itchy skin or a rash from poison ivy, while other reactions can be more severe, such as anaphylaxis. Anaphylaxis is a life-threatening reaction where the airway can swell, making it difficult to breathe. If not treated, it could ultimately lead to death. Are there peanuts in this sauce?
I thought you checked. Oh no. Did you eat any yet?
Yeah, I did. Oh, man.
Are you okay, Art?
I don't know. Oh, my throat is swelling. Art is showing signs and symptoms of anaphylaxis, which can be a combination of difficulty breathing, wheezing or shortness of breath, a tight feeling in the chest and throat, swelling of the lips, face, throat, or tongue, or weakness, dizziness, or confusion.
It's going to be okay. Do you have your epinephrine auto-injector?
Since Art had an epinephrine auto-injector, he used that to counteract the effects of the anaphylaxis. If the person has one on hand, use it as soon as possible, instead of delaying care to call 911. Before helping a person suffering from anaphylaxis, be sure to confirm a history of severe allergies, look for signs and symptoms of anaphylaxis, find out if the person needs help administering the auto-injector, and check that you have the person's own prescribed auto-injector. It is also important to be familiar with your state laws related to helping with an epinephrine auto-injector.
How do you feel?
A little better, thanks.
I'm calling 911.
When a person is suffering from anaphylactic shock, call 911 if the person has trouble breathing, complains of the throat tightening, explains that he or she is subject to severe allergic reactions, or becomes unresponsive. While waiting for EMS to arrive, Candace will monitor Art's breathing and for any changes in his condition. If the symptoms persist for 5 to 10 minutes without EMS on the scene, a second dose of epinephrine is advised.
Okay, so I want to reference one more time, and we're going to go back to sample. And when you think about talking to these people in the check, call, care situation, you check the area that it is a safe environment. If there were something there that would be detrimental to the situation, just the example would be a fire, explosives, those type of things. You may have to move the victim, obviously, to get them to put them in a safe environment. The call is always a simple thing to do. If you have a cell phone, or hopefully there's somebody in the area that you can call, shout to have them call 911. The care is the part that we're looking at. And remember the Good Samaritan Act, that if you are conscientious and you're trying to help a person, there is no reason not to. Meaning, don't worry about lawsuits. Don't worry about those scenarios if you are very conscientious in what you think you can do to help that individual or individuals. So the sample one more time, as the S And I'll put this in front of you one time so you can look at it. And if you can see it, and I don't know if that's legible or visible, possibly not, but let me just talk about sample what it is. The signs and symptoms, the S, allergies, the A, medications, ask the person if they have been taking any medication that could have caused the scenario or be part of the reason, or it could be part of what not to do. Pertinent medical information, meaning, so we know a person had anaphylactic shock, was in that, had an epinephrine, so we know that that individual had a pertinent medical history. Could be somebody that had a heart attack or a stroke previously, or diabetic, whatever. What's the last food or drink they had? And of course, what are the events leading up to? So good job, class. So now we're at about 11 minutes. I always ask if you want to watch this video twice. We're going to look at some questions on seizures and breathing. It'll be very simple. I wish you all a great day, and thumbs up. Here we go. Good night. Goodbye. Or good day.